In this video, we will talk about the different esophageal diseases that have a certain relationship with the anatomical knowledge that we have acquired in the previous two videos. Today, we'll talk about the esophageal motility disorders and the esophageal structural abnormalities. Welcome to a brand new class on DNMD, where you can learn everything related about the basic sciences of medical knowledge and apply it to patient care in the future or right now. In the first esophageal anatomy video, we talked about dysphagia, which meant difficulty swallowing. An important consideration in a patient complaining of this symptom is if the dysphagia is to solid food or liquids. Dysphagia only to solid food usually indicates that there is a structural problem with the esophagus, meaning that something is blocking the passage. Dysphagia to both liquids and solids at the same time usually indicates a motility disorder, meaning that the esophagus doesn't move to transport the food or liquids and the sphincters don't open. Progressive dysphagia, meaning initially to solids and then progresses to liquids, usually indicates a growth. It can be a cancer that is obstructing the esophagus. The movement of the esophagus or the rest of the gastrointestinal tract is called peristalsis, that is a wave-like movement that propels food forward. Pain from the esophagus that usually presents as chest pain is difficult to distinguish from cardiac pain, mainly because, as discussed in a previous video, both innervations reach the spinal cord at the same levels. Therefore, you should be careful and consider cardiac pain, especially when a patient has risk factors for heart disease. For example, obesity, high blood pressure, high lipids. And the final term is esophagitis. Itis in medicine means inflammation. Therefore, esophagitis means the inflammation of the esophagus. So when the esophagus gets sick, we need certain studies to determine what's wrong with it. The diagnostic studies used in the esophagus are endoscopy, which is a technique used to view the mucosa of the esophagus and detect any structural problems. It is done by using an endoscope, that is a long tube inserted through the mouth of the patient that has an optic fiber that generates a live video of the esophagus or the stomach. Manometry measures the pressure created by the esophageal muscles and its sphincters. The pressure is shown in different colors, as we can see in the picture here, depending on the amount of pressure and the part of the esophagus that is contracting. It is a must-do test when suspecting a motility disorder. It is done by introducing a probe through the nose and into the esophagus. pH monitoring is used to determine the esophageal pH and to diagnose gastroesophageal reflux disease, which is the reflux of stomach acid to the esophagus. A probe is introduced through the nose of the patient and into the esophagus. It measures the pH for 24 hours and records it in this tiny monitor that the patient carries with him. And finally, an esophagogram, also known as barium swallow, consists of the patient swallowing a solution made of barium. Since barium is a metal, it appears white on X-ray, so we can see the anatomy of the esophagus clearly. We'll begin with the motility abnormalities. These are problems in the movement of the esophagus that can be due to problems in the upper esophageal sphincter, lower esophageal sphincter, or the esophagus itself. Oropharyngeal dysfunction. As we learned before, the upper esophageal sphincter is made up of three muscles that are skeletal muscles and therefore are innervated by somatic motor neurons, and pathologies that can damage the brainstem or the cerebral cortex can cause a dysfunction of these muscles. For example, a stroke, myasthenia gravis, amyotrophic lateral sclerosis, among others. This usually causes oropharyngeal dysphagia. Achalasia is a disease that occurs when the lower esophageal sphincters fails to relax and allow the passage of food into the stomach. It is also associated with a decreased esophageal peristalsis. Food starts to accumulate and causes esophageal dysphagia and regurgitation of undigested food. A study useful to diagnose this is the esophagogram, that shows a dilation of the thoracic esophagus and a thin line where the lower esophageal sphincter is tightly constricted. This is known as the bird's beak sign. Diffuse esophageal spasm occurs when the esophagus contracts over and over again and can have a corkscrew appearance on the esophagogram. Manometry is used to diagnose this condition. And finally, we'll talk about some structural abnormalities. A stricture is a loss of lumen area, meaning that the esophagus gets narrower. The normal diameter is 20 mm, and less than 15 mm can cause dysphagia. There are different causes, but the most common is due to acid reflux disease, and this is known as a peptic stricture, and it represents 60 to 70% of all strictures. It is usually due to chronic irritation and inflammation of the esophageal mucosa, as we can see in this endoscopy due to the acid reflux from the stomach. A cricopharyngeal bar is a narrowing of the esophageal entrance due to a prominent appearance of the cricopharyngeal muscle. It can be a normal anatomical variant or secondary to fibrosis or increased basal tone of the upper esophageal sphincter. Remember that the cricopharyngeal muscle is part of the upper esophageal sphincter. As we can see in this esophagogram, there is a protrusion from the posterior aspect of the pharynx at the level of the C5-C6 vertebra. Esophageal rings are strictures that are made up of mucosa and/or muscle that occupy the entire circumference of the esophagus. They usually occur in the distal esophagus, meaning the final thoracic or abdominal esophagus, and they are divided into two types of rings. A rings are located above the C-line and are normal. They are due to the contraction of the strongest part of the lower esophageal sphincter. In contrast, B rings are located at the C-line, and the most common of these rings is known as Schatzki ring, as we can see in this barium swallow. This is why it's important to know about the C-line and the location of the gastroesophageal junction, so you can differentiate between A rings and B rings. Esophageal webs are strictures that are made up of only a thin layer of mucosa and only occupy a part of the circumference, as we can see in this endoscopy. They are usually located proximally, which means in the cervical esophagus or in the upper part of the thoracic esophagus, and they can be part of an interesting triad discovered by both US physicians and UK physicians. Do you know the name of this triad and which of the two other signs and symptoms were missing to complete it? Please write your answer in the comment section below. Esophageal diverticula, as discussed in a previous video, are like pouches. And besides the one that happened in the cervical esophagus that we have already learned, there are two more esophageal diverticula that you should know about. The mid-esophageal diverticula is located in the middle of the esophagus, as you can see in this esophagogram, and it can be due to two things. Traction diverticula occurs when something pulls the esophagus, for example fibrous tissue due to mediastinal tuberculosis, while pulsion diverticula occurs when forces from inside the esophageal lumen causes the outpouching, usually because of a motility disorder. This type of diverticula also includes the ones that we have learned before, the Killian's, Laimer, and Killian-Jamieson diverticula. Epiphrenic diverticula, on the other hand, happens in the distal thoracic esophagus, and it's close to the beginning of the lower esophageal sphincter and the esophageal hiatus. They are pulsion diverticula, and they are usually caused by a long-standing motility disorder, usually achalasia. As you can see, anatomy helps us understand these diseases. To understand achalasia, you first need to understand what's the lower esophageal sphincter. To understand the rings or the diverticula, you need to know in which sections the esophagus divides. However, this was just a brief discussion of these pathologies, but don't worry, in the upcoming pathology videos we will talk about these diseases in more detail. In the next video we'll talk about esophagitis, esophageal varices, esophageal cancer, gastroesophageal reflux disease, foreign bodies, and the emergencies of the esophagus. If you would like to read more about the topics discussed in this video, I'll put my reference down below in the description. Also, if you have any questions, please don't doubt to write it in the comment section. Before you do, make sure that your question wasn't asked already. If it has, please give that question a like, and the 3 questions with the most likes will be answered in the next video. Hey guys, thanks for watching. And remember, it's always for our patients. If you like this video and the content I make, please don't forget to subscribe, like, and share this video. With your help, I'm sure we can get free medical content to every corner of this world.